The United States spent $5.3 trillion on healthcare last year. That's the official number from the Centers for Medicare and Medicaid Services, the government agency that tracks this stuff. And just to put that in perspective, that works out to about $15,000 for every single person living in the country. Now you'd expect a country spending that much to have pretty remarkable health outcomes. Best life expectancy in the world. Healthiest population. Most advanced system. That's what you'd expect. But here's what the data actually shows. The Commonwealth Fund does this big comparison every few years of healthcare systems across wealthy countries. In 2024, they looked at 10 countries and ranked them on health outcomes. Life expectancy, preventable deaths, maternal mortality, infant mortality, all of it. The US came last. Not near the bottom. Last. Japan spends about half what the US spends per person on healthcare, and their life expectancy is 84 years. Switzerland is 84. Spain is 84. The US is 79. The US also has the highest rates of preventable deaths among wealthy nations, the highest maternal mortality, the highest infant mortality. 30% of American adults are living with 2 or more chronic conditions at the same time. So I started thinking about where $5.3 trillion is actually going, because it's clearly not going toward making Americans healthier. And when I started looking into it, I found something that I think explains a lot. In 2018, Goldman Sachs published a research report about gene therapy. Gene therapy is this new wave of medicine where instead of giving someone a pill to manage their condition every day, you actually go in and fix the underlying problem. Edit the DNA. One treatment. Potentially permanent. And in that report, an analyst named Salveen Richter asked a question that I've been thinking about ever since I read it. She asked, "Is curing patients a sustainable business model?" That's a real quote from a real Goldman Sachs report sent to real clients. She wrote that one-shot cures, while they carry tremendous value for patients and for society, could represent a challenge for genome medicine developers looking for sustained cash flow. Because if you cure someone, they stop being a customer. Now Goldman Sachs isn't a healthcare company. They're an investment bank. They're looking at the healthcare industry from the outside and asking whether curing diseases is actually a good business decision. And the concern they're raising, politely, in financial language, is that it might not be. And I think that question tells you more about how the healthcare industry actually works than almost anything else I came across. Because here's what happened when a company actually did cure something. Gilead Sciences developed treatments for hepatitis C in 2013 and 2014. These weren't just good treatments. Cure rates were above 90%. For a disease that millions of people had been managing their whole lives, this was a genuinely remarkable thing. And then the revenue numbers started coming in. In 2015, Gilead made $12.5 billion from those hepatitis C treatments. That was the peak. Because as more people were cured, there were fewer people left who needed the treatment. The market was getting smaller because the drug was working. Goldman Sachs actually cited Gilead specifically in that same report. They wrote that the success of the hepatitis C treatments had gradually exhausted the available pool of treatable patients. And they noted that curing an infectious disease also reduces the number of people who can spread it, so the future pool of new patients shrinks too. By 2018, hepatitis C revenue had fallen below $4 billion. It kept going down after that, so the treatment worked better than almost anything before it. And Gilead lost 2/3 of their revenue from that product because of it. And according to an investigation into pharmaceutical research incentives, what followed was entirely predictable. Companies now rationally choose to invest more in treatments that manage conditions over a lifetime than in treatments that eliminate them. Not because scientists don't want to cure diseases, but because the business model of lifetime management is more financially stable than the business model of a one-time cure. The most concrete example of what this looks like in practice is insulin. Insulin is not a new drug. It was first used to treat diabetes in 1921, over 100 years ago. The core science has been understood for generations. The original patents expired a long time ago. In 2020, Rand Corporation published a study comparing insulin prices across 33 countries using pharmaceutical market data from 2018. In the US, the average price per vial of insulin was $98.70. In Canada, it was $12. In the UK, it was $7.52. In Australia, it was $6.94. The US was paying 6.3 times more than Canada for the same insulin, 8.9 times more than the UK. A study published in Mayo Clinic Proceedings looked specifically at the US and Canada. In 2018, the US spent $28 billion on insulin. Canada spent $484 million. The average American insulin user spent $3,490 that year. The average Canadian paid $725. Same drug, made by the same companies. The difference is that Canada has a government body called the Patented Medicine Prices Review Board that regulates what drug companies can charge. The US has no equivalent. Drug companies can charge whatever they want. And people with diabetes don't have the option of just not buying insulin. They need it to stay alive, so they pay whatever the price is. There are documented cases of Americans driving across the border into Canada to buy insulin because they genuinely cannot afford it at home. In 2018, in the richest country in the world, for a drug that has existed for over a century. Now, the obvious question is, why doesn't the government just regulate drug prices the way Canada does, or the UK, or basically every other wealthy country? And the answer is pretty straightforward when you look at where the money goes. The pharmaceutical industry spent $388 million lobbying the US federal government in 2024. That's a record. And according to Sludge, they were on pace to beat it in 2025, spending $227 million in just the first 6 months of the year. PHRMA, the main trade association for drug companies, spent $31 million on lobbying in 2024 alone. The Inflation Reduction Act of 2022 gave Medicare the ability to negotiate drug prices directly with pharmaceutical companies for the first time in history, which sounds like a basic thing that should have existed already. And within months of it passing, the industry had deployed hundreds of lobbyists specifically to dismantle it. Public Citizen analyzed the lobbying activity and found 545 unique lobbyist-client relationships where the specific job was to gut that drug price negotiation program. The pharmaceutical industry spends more on lobbying than any other industry in Washington. More than oil, more than defense, more than finance. And what that money has bought over decades is a system where the US is the only wealthy country that doesn't regulate drug prices, where insulin costs 8 times more than in Canada for no medical or scientific reason, where the government was legally prevented for decades from negotiating the prices it pays for drugs on behalf of tens of millions of elderly Americans. I want to be careful here because I think it's easy to watch something like this and walk away thinking everyone in healthcare is corrupt or that there's some coordinated plan to keep people sick. That's not really what the evidence shows. Most doctors genuinely want to help their patients. Most researchers genuinely want to solve the problems they're working on. The science is hard and expensive, and most drug candidates fail. What the evidence does show is something more structural. An NCBI study on pharmaceutical research investment found that drug development decisions fundamentally come down to expected return on investment. Companies invest where they expect returns. If a disease affects mostly poor people in low-income countries, there's less investment in it. If a treatment requires a one-time payment, there's less interest than in a treatment that generates recurring revenue. If a drug can be slightly modified and repatented rather than replaced entirely, that's often the path companies take. This isn't unique to healthcare. It's how markets work. But healthcare is unusual because the customers often have no choice. A person with diabetes can't decide not to buy insulin because it's too expensive. A person with a serious illness can't just opt out of the system. And when you combine a market where customers have no choice with an industry that spends more on lobbying than any other sector to prevent price regulation, you end up with a system where the US spends $5.3 trillion a year and still comes last on health outcomes. So going back to that Goldman Sachs question, is curing patients a sustainable business model? The honest answer based on what happened to Gilead is, not really. Not under the current structure. A cure shrinks the market. A lifetime treatment sustains it. And the insulin situation shows what happens when there's no regulation to push back against that logic. A 100-year-old drug costs 8 times more in the US than in the country next door. None of this means cures are impossible or that nobody is trying. Gene therapy is genuinely promising. There are researchers doing remarkable work. But the financial incentives of the system as it currently exists point in a specific direction, toward managing conditions rather than eliminating them. toward treatments you take every day rather than treatments that work once, toward lobbying to prevent price regulation rather than competing on price. And until those incentives change, the outcomes probably won't either. See you next time.